Today we are talking about menopause. While it is a natural part of life, many people don't like to talk about it, but it doesn't have to be a mystery or a struggle. With the right information and support, women can take charge of this chapter with confidence. Tonight we are talking all about menopause, from hot flashes to brain fog, with Dr. Susan Miller from Cone Health Center for Women's Healthcare at Drawbridge Parkway. So to start, how does someone know if they are in menopause, and when does it usually start?
So most women know that they're in menopause because their menstrual cycles start to change and then ultimately stop. That time in life is generally between the ages of 45 and 55. It's not considered abnormal unless it starts before age 40. So the official definition is cessation of menstrual cycles for 1 year due to ovarian hypofunction or basically diminished ovarian function.
Gotcha. And what's the difference between perimenopause and menopause?
So perimenopause is that time before. The terminology is confusing sometimes for folks because it all kind of sounds the same. So it can be as short as a few months before actually cycles stop. It can be years. There are women that do really struggle with perimenopausal symptoms for even up to 10 years before they actually go into menopause.
Gotcha. And I must have missed this part. Did you say the specific age group that it usually starts when it comes to menopause and people start feeling those symptoms?
Yes, usually between 45 and 55 is actually when menopause occurs.
Okay.
That the specific average age for women in the United States is 52.
Gotcha. Moving on here, how does surgical menopause differ from the typical menopause transition, and how can women manage the changes if it happens early?
So surgical means removal of the ovaries. So all of a sudden the ovaries are gone and all of a sudden the estrogen's gone. So it's very sudden and it's not as gradual a transition as occurs for women who go through natural menopause. One confusing question or conversation I sometimes have with patients who are thinking about surgery is that a hysterectomy is not actually removal of the ovaries. So you can have a hysterectomy and still actually keep ovarian function because your ovaries can stay and not be removed at the time of surgery. So that's a little bit confusing for folks, but the surgical menopause is actually when the ovaries are removed. And because it is so sudden, very often when I'm having conversations with my patients about removal of ovaries, we're talking about what we're going to do to manage the symptoms immediately after surgery because they do occur really quickly instead of waiting and seeing what occurs as is more common the process with menopause when it's not surgical.
How do you know if you are a good candidate for surgery when it comes to menopause?
So ask that question to me in a different way, please.
Yeah, how do you know if surgery is an option that you might need to undergo? Is there something that might occur where it's a doctor might say, hey, let's make sure you go through the surgery process. How do you
Right.
know?
So for removal of ovaries, since we're talking about menopause, the most common reason for removal of ovaries would be usually from pain issues, an endometriosis, or someone has an increased risk of ovarian cancer discovered through genetic screening. So now, when we do hysterectomies for bleeding, we very much or very often leave ovaries because that helps to it helps to benefit. It helps with cardiovascular benefit later in life. So generally, ovary removal has to do with pain, endometriosis, and then genetic risk for ovarian cancer.
Gotcha. And there are a lot of symptoms: hot flashes, sleep issues, mood changes, or just to name a few. But what are the most common symptoms?
The most common symptom is hot flashes. Outside of that, conversations just today with patients, decreased libido, vaginal dryness, which sometimes can impact intercourse, so pain with intercourse, sleep disturbance from hot flashes at night. We sometimes will talk about mood swings, mood changes that occur in menopause. It is really a broad spectrum of symptoms.
How can you manage the symptoms?
There's a lot of options, from non-hormonal herbal remedies to prescriptions. I think a lot of times the conversation goes straight to estrogen and hormone replacement therapy, which absolutely has a role in management of menopausal symptoms. But there are other non-hormonal medications that we can use, and even herbal therapies. I have some patients who've done acupuncture, and so a little bit less traditional treatments for hot flashes, and other menopausal symptoms. I think the thing that's really difficult is that it's not a sort of a one thing fixes everything for all women. So you really have to think about the spectrum of symptoms and what are the symptoms that we're really trying to address. So, for example, we would talk about, or I would talk about, the mood swing issues and mood changes differently than I might someone who's really having a lot of issues with night sweats and sleep disturbance. So it's not just a one thing does it for every single person.
Yeah, absolutely. Well, we are going to pause the conversation right now, but we will continue after the break. We are talking about what you should know about menopause. We'll be right back.